Hi, my name is Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice in Appleton, Wisconsin since 1983. I'm the author of this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment of Dizziness, Migraine Headaches, Fibromyalgia, and Other Chronic Conditions. Did you get that? I wrote the book on migraines. How do I know that? I suffered with migraines. I suffered with migraine headaches from 1989 to 1998, August of 1998. And someone turned me on to a doctor, Dr. Frederick Carrick, the country's leading chiropractic neurologist and chiropractic's only neurological fellow. And I have not suffered with migraine since. So, in addition, I consult with over 1,000 chiropractors across the country on what I'm about to share with you on migraine headaches. Go to lifechangingcare.com, that's lifechangingcare.com, and you can see all of the doctors and all of the testimonials. So let's get into it. What makes us different? What makes my office different from every doctor you've seen? Well, most likely you've had an MRI, you don't have a hard lesion, which is a tumor or stroke, but you have a soft lesion, some lack of firing in the brain, and you have a metabolic problem. So what makes us different is we treat you neurologically and metabolically. So you're watching this video because someone you know or yourself is suffering with migraine, and I'm here to tell you that no stone is left unturned to get to the exact cause of why you're having problems with migraines. So how do I successfully treat migraines? I just told you, metabolically and neurologically, right and left hand. So the first thing we're going to do is a blood workup. And I know what you're saying. Dr. Johnson, I've had blood work done. It's all normal. It's all normal. Keep in mind there are lab ranges, which are very broad. Okay? And there are functional ranges or optimal ranges that are a lot narrower. For instance, lab range on TSH, thyroid stimulating hormone. The thyroid controls all your body metabolism. Very broad, 0.5 to 5.0. The optimal range is 1.8 to 3.0. So you could be at 4.2 and be lab normal, but functionally hypothyroid. That could be causing your migraines. See, what I'm going to tell you, nobody else has told you. I guarantee you nobody else has told you because I teach 1,000 other doctors all of what I'm about to tell you. So we wanted to use specific lab panels, a thyroid panel, a complete metabolic panel, a CBC with autodifferential, meaning we're testing red and white blood cells, oxygen carrying capacity in the red blood cells, immune system function in the white blood cells, and finally a lipid panel. And like I said, oh, my doctor ran all these tests, it was normal. Many times doctors will run limited panels. I mean, I'm amazed. Oh yeah, I've had blood work done. They've had like 3 tests done. They've had glucose, and maybe they did a lipid panel. So we can assess your thyroid, your adrenal glands, liver, kidneys, red and white blood cells, gut function with the above lab tests. All of those internal functioning organs can have an effect on why you're suffering with migraines. Another thing we do is sensitivity testing. We want to test you to see if you're sensitive to gluten. What is gluten? Wheat, rye, oats, barley. So we want to check and see if you're sensitive to gluten, milk, soy, eggs, and yeast. I myself have had this test and I'm sensitive to gluten, milk, and soy. If you're sensitive to any of these food groups, you could be, here are some of the symptoms with the sensitivities. Let's just go there. Chronic pain or fatigue. Well, if you got migraines, you got chronic pain. Frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers. I've only had one patient tell me they had mouth ulcers, and normal test is 0 to 10 units. She was at 400 units, off the charts. Got her off gluten, her symptoms were improved by 80%. Or they vomit often. I haven't had anybody tell me that. But the only way to find out if you're sensitive is to run the test. We may do an adrenal stress index. The adrenal glands sit right above the kidneys. They're your stress glands. Has to do with cortisol level, blood glucose levels. If you're having trouble sleeping or anybody that has insomnia, guess what? Their adrenals are off. We run immune panels. There's 2 parts to your immune system, Th1 and Th2. We want to find out which one is dominant by checking specific markers. This is a blood test. Now, if you're Th1 dominant, you're going to find markers TNF-alpha and interleukin-2 are elevated. If you're Th2 dominant, you're going to find markers interleukin-4 and interleukin-10 dominant or high. Now, interleukin-2 and TNF-alpha, the Th1 system, Th1 is T cells. T cells are the army that attacks, cleans up afterward. There's helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Interleukin-4 and interleukin-10, the Th2 part of your immune system, are B cells. B cells make antibodies. They tell the T cells what to attack. So that's what we're looking at. So if you're, say for instance, you come in and you're Th1 dominant, then we want to find out what's causing that dominant factor. Is it an antigen or is it dysregulation? Active antigens are parasites, bacteria, viruses, mold, yeast, fungi, protozoan, foods, that sensitivity test, chemicals and heavy metals. The best indicator of an active antigen is the helper suppressor T cell ratio, also called CD4 and CD8. And if that ratio is close to 2.5 or higher, you have an active antigen. If it's 1.2 or lower, you have a problem with dysregulation. It's a problem with blood sugar, anemia, gut function, something along those lines. You don't know unless you run the test. You see, it's easy to go to a medical doctor and say, okay, I have migraines. Here's the medication, thank you. Oh, that one's not working anymore. Let's try a different one. And I'm not saying stop taking the medication. That's practicing medicine without a license. I am saying realize the side effects to those medications. Look for an alternative like I'm offering you. So, you could have an autoimmune problem. Your immune system is attacking your brain, and that's why you have migraines. It's a possibility. The only way to find out is to test for it. One of the antigens, like I said, could be bacteria, H. pylori, so we can test for that. You could have a leaky gut syndrome. Leaky gut, it's a condition where there's altered or damaged bowel lining caused by antibiotics, toxins, poor diets, parasites, infection. It's a possibility, but you don't leave any stone unturned. Remember when I first said that in the very beginning, you're suffering with a condition that will, at least it did for me, it would happen. Severe migraines, like somebody's putting a spike through my left eye, vomiting at least twice a week. Oh my gosh, and some days I'd have to adjust a patient, go to the bathroom, throw up, come back, clean myself up, adjust another patient. It was crazy. I've been there. Problem could be caused by neurotransmitters. With women, your migraine could be caused by hormone panels. A lot of women, their migraine started at about the time that they started their menses. So there could be hormone problems. But let me tell you something, autoimmune trumps everything. If you're autoimmune, you deal with that first, and then you get on to the hormones. Because once you clear up the autoimmune problem, the hormones come back in line. But you test for it. If you don't know unless you test. You want to check for inflammation. I guarantee you have inflammation. So you check C-reactive protein and homocysteine levels. One of the biggest things that we can do to help people with migraines or any metabolic problems is use glutathione. Glutathione is a natural antioxidant. It's like the mother lode of antioxidants. So that's the metabolic side, folks. Now the neurological side. And, when I wrote my book, you'll see all the neurological aspects of it. And if you come in, I'll give you a free copy of my book. But now we've added the metabolic side, and it makes it that much more powerful. Do you see that? So, we use oxygen therapy. Oxygen is fuel for your brain and nervous system. This is how I got rid of migraines. Exercise with oxygen therapy. I had sciatica. How did I get rid of it? Exercise with oxygen therapy. You've been to how many doctors? You've been to numerous chiropractors probably. But you haven't been to a doctor who's treating you neurologically and metabolically. Functional neurology,